Hello, I'm Dr. Sreeja, one of the senior consultants at Kinder Hospital, Bangalore. Today, we'll be discussing on nausea and vomiting of pregnancy. This is Monica, one of the staff nurse working at Kinder Hospital, Whitefield. So together, we'll be discussing about this morning sickness in pregnancy.
Hello. Doctor, to start off this session, could you explain me what is meant by nausea and vomiting of pregnancy?
Nausea and vomiting of pregnancy is one of the common symptoms which affects most women to some degree.
Okay.
And it usually starts by 4 to 7 weeks and it ends by 12 to 14 weeks. But in some cases, it can be very severe. It is called morning sickness, but it can happen at any time of the day, like morning or evening or even at night. So, this is thought to be due to some pregnancy hormones, but it is not clear why it happens in some women more than in others.
Okay.
You are more likely to have nausea and vomiting of pregnancy, especially if you have had it in your previous pregnancy, or if you are carrying twins or triplets, or if you are having a condition called molar pregnancy. Molar pregnancy is a condition when you have abnormal growth of the placenta and the baby is not formed correctly. That you can have severe nausea and vomiting. So when you have nausea and vomiting, certain other conditions also have to be ruled out, especially if you're having tummy pain or fever, or if you're having nausea and vomiting after 10 weeks.
Okay.
Some of the other conditions which can cause nausea and vomiting are appendicitis, kidney infection, gastritis, or a gastroenteritis. Gastritis and gastroenteritis are inflammation of the bowel.
So how does this nausea and vomiting differs from hyperemesis gravidarum?
Hyperemesis gravidarum is a condition when there is severe nausea and vomiting, which results in weight loss, significant weight loss and dehydration. It happens in 1 to 3 out of 100 pregnancies. The signs of dehydration include feeling dry or very thirsty, feeling unwell or drowsy, or you can have a urine from pale yellow to dark yellow or red.
Okay.
In these severe cases, you have to meet a doctor and you might be admitted in hospital.
Okay. So how will it make the patient feel? How does it feel like?
Nausea and vomiting of pregnancy can be a difficult problem to cope with.
Okay.
It can affect your mood, your work, the family situation and your ability to care for your family.
Right.
You need a lot of support from your family and friends to overcome this. In severe cases with the symptoms, some women get depressed and they need support, counseling support.
Okay.
If you are persistently feeling low down, you have to meet your doctor and the doctor can help you decide whether you need counseling or not.
Okay. But will it harm the baby?
There is no evidence that nausea and vomiting can harm the baby.
Okay.
In fact, there is a lesser risk of miscarriage if you are having nausea and vomiting. But in severe cases like hyperemesis gravidarum, it can cause a low birth weight of the baby, lower than expected.
Okay.
Your doctor might advise you to do serial scans to monitor the growth of the baby in such cases.
Okay. So in this situation, what can the woman do to help herself?
Most of the women can manage nausea and vomiting themselves.
Okay.
So what of the measures include taking food like rich in carbohydrates and low in fat like potatoes, rice, pasta, and also biscuits and crackers would help.
Okay.
And small frequent meals can help reduce the nausea and vomiting. Also, you should avoid food that triggers nausea and vomiting, food or smell that triggers nausea and vomiting.
Okay.
Also, food containing ginger products, food or drinks containing ginger products can also reduce the symptoms. But be careful when you take a lot of ginger because again it can irritate the stomach.
Okay. So you have mentioned all these measures. So what if the symptoms does not settle with all these measures? What is the next step?
Okay, if you're having nausea and vomiting, your doctor might also advise anti-sickness medications. So with these medicines, if it is not coming down, you have to meet a doctor.
Okay. And what happens in the hospital?
If you are going to the hospital with nausea and vomiting, first you will be assessed. You will be asked few questions, like how long have you been having the symptoms? Then are you able to keep anything down, or you vomiting everything out? If whether fluids or food, were you able to keep down anything? Then you will be asked about significant weight loss, whether you had it in the previous pregnancy, whether you are having any other medical condition, and whether you're having tummy pain, fever, or any other symptoms. You'll be checked for signs of dehydration also in the hospital. You'll have your blood pressure checked, pulse rate, temperature, respiratory rate, and weight checked during pregnancy. And you'll be given some blood test, urine test and blood test, and an ultrasound scan has to be done. The ultrasound scan is done to rule out twins or triplets, and also molar pregnancy.
Alright. And when did you get the patient admitted in the hospital?
Usually when the patient comes, and if you are able to take fluids, little amount of fluids but not adequate, you will be given drips in the arm, and by the end of it you will feel better and you will be able to go home. Most women can go home after some drips in the arm and anti-sickness medication. But in severe cases, like if you are not able to tolerate any amount of fluids, or if your urine test shows ketones, if your blood tests are abnormal, then you need to be admitted. Also, if you have other conditions like kidney disease, or diabetes, or heart problems, or you have significant weight loss and severe nausea and vomiting, then you will be admitted to the hospital.
So what happens after the admission to the hospital?
After the admission to the hospital, you will be given drips in the arm. Also, we'll keep monitoring about how much fluids you are able to intake, like through the drips and orally. And also, we'll monitor the amount of urine that passes out. We'll be monitoring that. Also, the blood pressure, the respiratory rate, weight, temperature will be checked, and every day. And you'll be given anti-sickness medication through the drip in the arm. Also, we'll give you a B vitamin called thiamine. So to help reduce the symptoms, this is also given. And once you are able to tolerate little amount of fluids, and if you are given anti-sickness medication, and you can go back home, you can keep taking fluids and food little by little until go back to your normal diet gradually.
So you have mentioned about anti-sickness medication. So what are these medication, sickness medication which you offered in the hospital?
Anti-sickness medication can be of different types. So anti-sickness medication include antihistamines. These are cyclizine, doxylamine succinate or doxynate, prochlorperazole, metoclopramide. These are all the first line anti-sickness medication. If this doesn't work, we give a second line anti-sickness medication called Emset or ondansetron. Most of the women will recover by this. If it is still persistent, we might have to give some medicines called corticosteroids. This is if you have severe nausea and vomiting not controlled with a normal anti-sickness medication, or you have significant weight loss which is not getting corrected by anti-sickness medication, you might be given corticosteroids. This will be given in small amounts only. Mostly you might be able to discontinue it by 20 weeks. But some women, around 1 in 5 women, might require it till the end of pregnancy. Mostly, these medicines will not have much side effects and are generally considered safe in pregnancy. But the harmful effects of severe nausea and vomiting can be much more than the possible side effects of this medication. And even in the steroids, only a very small percentage of this will go on to the baby. Mostly, there will not be much effects and they are considered safe.
And what happened after the discharge, when the patient gets discharged?
After discharge, along with the discharge, you will be given anti-sickness medication, which you can take at home. So you can take it in small amounts, and when your symptoms improve, you can cut down on the anti-sickness medication. But sometimes the symptoms may recur, and then you have to stop taking solid food and keep sipping liquids along with the anti-sickness medication. And once the symptoms improve, you can start with a normal diet. Sometimes it can recur also. The severe nausea and vomiting can recur. In that case, you might require to get admitted in the hospital again. Though it is a very distressing condition, it can stop by around 20 weeks in most women. Very rarely, occasionally, it can continue up to the end of the pregnancy. But once the delivery is over, all the symptoms disappear totally.
Okay, so that is all about today's session. So we want to give some.
We'll just check in the Facebook if there are any questions coming up.
Yeah, sure.
I'll just check. There are no questions as of now.
So you want to give some take-home message to our viewers?
Well, thank you for listening. Nausea and vomiting, though it is a distressing condition, there are measures to prevent. Not prevent it, to control it, and definitely it will disappear by most of the women. It will disappear by 3rd to 5th month, and very rarely it can go up to pregnancy.
Okay, so thank you, Dr. Sreeja. So viewers, so that's all about today's session. Stay tuned for more updates. Thank you for watching.
Thank you.